Hi everyone. Today we're going to talk about something important, natural, and totally normal, reproductive health. Let's start with how pregnancy happens. Your body has a few steps it goes through to make a pregnancy possible, even if that's not something you're planning to do anytime soon. First, there's something called ovulation. That's when an egg is released from an ovary. This happens about once a month, thanks to hormones your body makes. The egg travels through a tiny tube called a fallopian tube toward the uterus. If a sperm cell joins up with the egg during that time, usually from semen entering the vagina, fertilization happens. But pregnancy doesn't actually begin until the fertilized egg attaches to the uterus. That's called implantation. If the egg doesn't get fertilized, the uterus cleans out the extra stuff it made to prepare for a pregnancy, and that's what causes a period. Now let's talk about why unplanned pregnancies sometimes happen. Sometimes people don't use birth control or they don't use it correctly. Some people don't feel comfortable talking about it, or they might not have access to birth control. Things like peer pressure, alcohol, or just not being ready can all affect decisions about sex. It's important to have good information and be prepared. Why do some teens have sex? Well, there are a lot of reasons. Some feel pressure from a partner, some are curious, and some think it will make them feel more grown up. These are big decisions, and it's important to think about your own values and feelings. Let's talk about birth control, or more formally, contraceptive methods. These are ways people can prevent pregnancy when they have sex. There are a lot of options, and no single method is perfect for everyone. The best choice depends on your body, your goals, and your lifestyle. We're going to break down the main types of contraception so you know what's out there and how they work. Hormonal methods. Hormonal birth control changes hormone levels in the body to stop ovulation or to make it harder for sperm to reach an egg. There are a few types. The pill, taken once a day. The patch, worn on the skin and changed weekly. The ring, which is placed in the vagina and replaced monthly. The shot, an injection every 3 months. These are all prescription only and work best when used consistently. Some people love the extra benefits, like lighter periods or clearer skin, but they can also cause side effects like mood changes or nausea. Everyone reacts differently. Barrier methods. Barrier methods physically block sperm from reaching the egg. These include male condoms, the most common, internal condoms, which go up inside the vagina, diaphragms and cervical caps, which are reusable cups placed over the cervix, sponges, which also cover the cervix and release spermicide. Condoms are the only method that also protect against sexually transmitted infections, or STIs. That's why a lot of people use condoms and another method. This is called dual protection. Long-acting reversible contraception, or LARC. These are the most effective types of birth control. Once they're in, they work for years, but you can get them removed anytime. There are two main kinds. The implant, a tiny rod placed in the arm that releases hormones, and IUDs, or intrauterine devices, which go inside the uterus. Some use hormones, and one is made of copper. LARCs don't rely on daily attention, which makes them super low maintenance, but you need a healthcare provider to insert or remove them. Emergency contraception. If something goes wrong, like a condom breaks, emergency contraception can help prevent pregnancy after sex. These are pills you can take. Plan B, available over the counter, works best within 3 days. Ella, prescription only, works up to 5 days. There's also the copper IUD, which can be used as emergency contraception and then left in for long-term use. The sooner you act, the better it works. Permanent methods. For people who are sure they don't want to have biological children in the future, sterilization is an option. These are procedures for both men and women that block or cut the tubes that carry sperm or eggs. These are considered permanent, so they're only recommended for adults who are totally sure. Behavioral methods. These depend on tracking or timing, not using devices or medicine. Examples include withdrawal or pulling out before ejaculation, fertility awareness, which involves tracking your cycle to avoid sex during fertile days. These methods take a lot of planning and don't work as well as others, especially for teens. Abstinence, which means choosing not to have sex, is also considered a behavioral method. It's the only method that's 100% effective at preventing pregnancy and STIs. And it's the only behavioral method especially recommended for teens. Choosing what's right for you. There's no best method, just what's best for you. It's totally okay to ask questions, explore your options, and even switch methods later on. If and when you decide to have sex, it's important to protect yourself, not just from pregnancy, but also from infections and from pressure or situations that don't feel right. Being informed is part of being safe. Now let's talk about taking care of your reproductive health. Girls are encouraged to have their first gynecology visit between ages 13 and 15. This is a safe place to talk about periods, birth control, and anything else going on with your body. In California, you can get reproductive health care like STI testing, birth control, and pregnancy tests, even during school hours, without needing a parent's consent. So who can you talk to? A trusted adult, a school nurse, your doctor, or websites like teensource.org are great places to start.